There has been a high interest in the cardiovascular effects of drugs targeting glycemia in patients with diabetes, in particular patients with high risk. And these two trials, EXAMINE and TIMI-53, presented for the first time clinical outcome data of cardiovascular events in patients with coronary disease, and the EXAMINE trial in patients with coronary disease at particular high risk because they were after an acute coronary syndrome and had diabetes. The result of these trials are reassuring from the aspect that both agents did not increase cardiovascular events, which was a major concern, in particular after the debate we had, for example, around rosiglitazone. On the other hand, there were also no signs for a reduction of cardiovascular risk using these agents, so clearly they seem to help us in the control of hyperglycemia, but they do not reduce cardiovascular events. Another, I think, very important aspect and highly discussed was the question of the effects on the pancreas. And this, especially the TIMI-53 trial, has reported here a large-scale analysis suggesting that there is no increase in the risk from pancreatitis and pancreatic cancer, at least for the duration of the follow-up that was performed in the trial.
And so do you think this will lead to roughly the same level of usage of these drugs in patients with diabetes and cardiovascular disease history, or should they change that use?
I think it's reassuring that these agents appear to be safe in patients with high risk and coronary disease, so I think it will certainly not reduce the use of these agents. I would imagine if we had seen a major impact on a reduction on cardiovascular events, that might have resulted in a substantial increase in the use of these agents.
And so what do you think is the take-home message from these two studies, the message for cardiologists?
I think the take-home message is that these two trials provide reassuring data that these agents are safe to control hyperglycemia in high-risk patients with diabetes and coronary disease. It also shows to us that we need to look for other approaches to reduce cardiovascular risk in these patients.